Hi all. There are mainly two assessment criteria for OET speaking. First one is linguistic criteria and second one clinical communication criteria. The four elements involved in linguistic criteria are 1. Intelligibility, 2. Fluency, 3. Appropriateness of language, 4. Resources of grammar and expression. First one, intelligibility, means whether the examiner can understand what you are saying. This includes whether your voice is clear and if you are pronouncing your words correctly. You should not speak too fast or too slowly but should maintain a natural rhythm. Word stress and intonation are also important. In general, the examiner should not be straining to try and understand what you are saying. Second one is fluency. It refers to the smoothness of your speech. It means that you do not pause for too long while searching for the right words. You should avoid the excessive use of fillers such as okner. Third one is appropriateness of language. It is all about using language that is suitable to your listener. Please do not use all the medical jargon you know when you are communicating with a patient or a patient's next of kin. This is because your listener may not be familiar with the medical terminology. Tone of voice is included in appropriateness of language. You will need to adopt the correct tone and volume when delivering different messages, especially sensitive information or bad news. Fourth one is resourcefulness of grammar and expression. It means about your range of vocabulary. It includes being able to paraphrase when necessary. In fact, paraphrasing is an essential skill. Please do not repeat the word again and again while speaking. Next criteria is clinical communication criteria. There are 5 elements in this criteria. These are 1. Relationship building, 2. Understanding and incorporating the patient's perspective, 3. Providing structure, 4. Information gathering, 5. Information giving. First one, relationship building, means that you are interested in building a good professional relationship with your patient or the patient's next of kin. In order to meet this, greetings are essential. For instance, good morning, John. How are you feeling today? It is important when greeting a patient in a hospital ward. It is also important to introduce yourself and let the patient know the purpose of your communication. Throughout your speaking, you will need to adopt the right tone that is always respectful and non-judgmental. It is also crucial that you empathize with the patient. But empathy does not lead you to offer or promise something that goes against professional policy. For instance, if a patient complains about hospital food, you can empathize with the patient and offer some suggestions within the constraints of hospital policy. But you should never allow the patient to bring in unauthorized food if it is against the hospital rules. Keep in mind that attentiveness is also important as part of relationship building. That means you need to show an interest in what the patient is saying. Second one is understanding and incorporating the patient's perspective. It means you will need to listen actively to what the patient is telling you because you will need to relate your explanations to the patient based on what information you have acquired from the patient. It is therefore good to do a repeat back to the patient, so that you can check that you have understood what the patient has said. Also, you need to pick up patient's cues such as hints, pauses, hesitations, and change in volume. Because some patients are hesitant to express what they feel in a clinical setting. Third one is providing structure. It means taking charge of directing the conversation purposefully and meaningfully. You are expected to be in charge of the conversation. Signposting is useful in providing structure. For instance, you can say like, so, first I will explain to you about inhaler usage, then, I will show you how to use it. And at the end, if you have any questions, you can ask me. Another important thing you need to know is that repetitions are sometimes necessary. You can repeat some parts of the interaction or paraphrase it. For instance, instead of repeatedly saying like, you need to do this exercise carefully at home, you can say, you need to do this exercise extremely carefully at home. Fourth one is information gathering. It means that you are skilled in obtaining information. You will need to use active listening techniques and minimize interruptions when the patient is speaking. You should use open-ended questions in the beginning. That means instead of asking closed-ended questions like, Are you feeling unwell today? You can ask open-ended questions like, what seems to be bothering you today? So that you will elicit more from the patient. Apart from that, you are expected to be able to clarify vague statements to make sure that you have understood the patient correctly. You should also be able to summarize what the patient has told you. Fifth one is information giving. It means that you are able to convey your message appropriately to the patient as well. You will also need to give the patient information as well. You have to ask what the patient already knows, and encourage the patient to tell their own reactions or feelings. Apart from that, you will need to periodically check whether the patient has understood you. Always try to discover if the patient needs further information. These are the speaking criteria for OET speaking test. For the speaking subtest, each assessor scores your performance according to these 9 criteria. Please remember, the 4 linguistically-oriented criteria are intelligibility, fluency, appropriateness of language, and resources of grammar and expression. They are assessed on a scale from 0 to 6. So give more focus on these criteria. Clinical communication criteria include relationship building, understanding and incorporating the patient's perspective, providing structure, information gathering and information giving. They are assessed on a scale from 0 to 3. Hope you all understood. Thank you all.